Welcome back to another episode from the Optimal Body Podcast. I'm Dr. Dom.
I'm Doc Jen.
And today we're going to be talking about hip arthritis or hip osteoarthritis. This is a highly requested topic, and we're going to dive into it. What are the symptoms? What can you do? And is it actually related to degeneration of the hip? All right, so hip osteoarthritis. I'm always excited when we talk through topics like this because we really dive into some of the research. And today we actually decided to have our computers in front of us so that we could just find the quoted material or find the different statistics from studies a little bit easier.
I mean, it's just reality. We're not going to memorize it, so it's in front of us.
We have it on notes anyways, so why not just have it right in front of us?
Yes.
And there's some really significant findings that I think when it comes to finding degeneration on the MRI versus if you're having pain that we're going to dive into later. But before we get into all the nitty gritty, please comment below. Are you someone with hip pain? Are you someone who's been told you have hip arthritis? What have you done that helps? Do you have any specific questions? Also, make sure to hit the subscribe button and notification bell before we get into it. Osteoarthritis, I mean the word itself, osteo meaning bone, arthro or arth meaning joint, itis meaning some sort of inflammatory condition. And so when people think arthritis a lot, they think degeneration. They think, oh, we're going to see some massive degeneration on a radiograph, on an MRI, on an X-ray, and that's what's causing the pain. But I think one of the most significant things when we were looking through the research was this quote here, and this is why it's great to have the computers in front of us, was this is a whole person condition where biopsychosocial factors modulate inflammatory processes as well as behavioral responses, trigger pain and disability to affect a person's joint health, not solely structural damage, which is a little narrative that needs to be fixed.
Pain can't just mean there's structural damage in an area.
Yeah.
There's your whole person. There's a lot more to the picture. That's what biopsychosocial means. Bio meaning your body. So yes, let's look at like structurally what's happening, but psychologically, what are you in? Are you in a lot of stress in your life? Are you going through a lot? Are there emotional things that are happening? Socially, what is happening? Do you have support? Are you economically like challenged in ways? Like all of those added stressors add to the pain that we're perceiving within our body.
A deep feeling pain kind of right in the front of the hip is what most common, and people will often give you what they call a C sign.
Yeah.
C sign where they grab and point with their front two fingers and say right here in the front of the hip, kind of with this C. Those are some of the symptoms people are going to be presenting with.
Totally. But that's where it's like, we can't just say, oh, here are the common symptoms and you're going to automatically jump and think that you have this, right? Because we can also see a lot of those symptoms play a role in impingement, labral issues, tears, FAI. A lot of these symptoms are going to be common with clicking or having that C-shine shape, filling it deep into the joint. So we can't know exactly unless you're going to do some more findings. But let's look at the research. Do we need to do more of the MRI finding? Are there other things that we can start taking charge of if you're having hip pain right now?
One of the biggest findings when we're talking about arthritis or arthritic conditions is that conservative treatment, specifically different forms of exercise, can be very, very effective in helping reduce pain, increase function, make you feel like you have a better quality of life, and even reduce the chances that you'll go into surgery or prolong when you end up having surgery, like a joint replacement or something.
What exercise should I do? What is the one exercise?
Specific exercise.
Yeah, or at least the exercise type, right? That I should be doing that's going to be best for my body. And you might even think, it would make sense to do more water-based things that take pressure off of your hip and deload. But what we're seeing from the research is that there's no one standard exercise protocol that's going to be better than another.
Yeah.
It really is, patient specific, really. Like, what do you enjoy more that you're going to actually keep doing and moving that's going to help promote more movement within your body? So different forms of exercise that we looked at based on the research was like strength, progressive resistance training. So making sure that you're kind of following a program or being guided by someone that progressively is kind of allowing you to increase your strength. Water-based exercises, aerobic exercises, performance or functional based exercises, meaning going just walking programs, hiking, stairs, stuff like that, or neuromuscular type training. So all of these have been studied in research, and we can see improvements with continuation on any one of them.
The specific type of exercise wasn't as important, but the things that did seem to be very important are that they were directed programs. So you were working with somebody who could direct your progress you based on how you were feeling, talk to you about symptoms that might come up during the exercises, and that it was something that the patient enjoyed, or that it was a patient preferentially selected exercise.
We're not here to say exercise is everything, you're not going to need a joint replacement and you're fine, right?
Yeah.
Like, of course not. There's different severity for every person, and it depends. If it's severely limiting your ability to go through your everyday life, we're probably going to say, and you've tried exercise, you've tried some conservative treatment, we're going to say it's probably best for you to get a replacement. And at this point in time, we've progressed in hip replacements so well, you're walking out really good without barely having any restrictions in range of motion now based on what we're doing. But what they are seeing from research is that if a patient ultimately decides to request having a replacement done, having participated in a preceding exercise program will lead to a faster post-operative recovery. So even if you think this is where I'm ultimately going to end up, do exercise first still.
Yeah.
Preferably guided from a physical therapist, and then go in and have the surgery, and then come out and still see, okay, where can I help to continue on?
You go into these exercise programs, it doesn't mean that your pain level is going to drop to zero.
No.
A lot of the studies said they consulted with patients saying that after exercise, there may be some level of pain, maybe even some level of increased pain. Again, anytime we're talking about an inflammatory type disorder or a disorder where when you put more pressure on the area, it can irritate it more, they were consulted with saying, hey, you might see some base level of increased pain after these exercise protocols. The important thing is, does that come down to the level you were at before or even slightly better? If it does, then we go on with a second session. And the goal in some of these studies was to get people to the point where they were doing 3 sessions a week. You know, that seemed like if you were able to get to the point where you're doing 3 sessions a week of training, it would increase the outcomes. It would increase your probability of having better strength gains, functional gains, versus maybe just going in for 1 or 2 sessions a week.
It is our natural instinct to say, oh my gosh, I'm having this pain and it's happening very often, or it's happening all the time. I need to see that image. I need to see how damaged something looks, you know, or how degenerative something looks. Like, we look at these big words and we're trying to make it make sense in our head. We want that validation of what I'm feeling is what I'm going to see. And the reality is that doesn't always go hand in hand, and that's okay. It doesn't invalidate what you're feeling.
No.
You're still feeling something very significant.
Absolutely. But even what you were saying right there, and the words that are used, how damaged the joint is, how degenerated it is, how messed up my hip is, that right there adds into that biopsychosocial model.
Yep.
When you see an image, you have hip pain, you see an image, you see the degeneration, and have a doctor walk in his lab coats and says, oh, you've got hip OA. Look at how degenerated your hip is. That starts to play into that psychological portion of the biopsychosocial model to say, this is why my hip is so damaged. I can't move without grinding my bones against each other. All these things that we start to tell ourselves once we see damage in the hip, right? Rather than saying, okay, there's damage there. What can I do in the rest of my life? Or
instead of saying there's damage, there's changes that are happening.
There's fairly natural age-related changes happening in my hip.
Yes.
And that I think a lot of surgeons, a lot of doctors are starting to move in that direction, because we're realizing how common this type of degeneration is, and that many people can be very functional, relatively pain-free, and live happy lives with high quality of life, even with degeneration on their images.
Yes. Another thing that we saw come up in some of the studies was looking at the weight that we carry on our body and how that does play a role in possibly leading to a hip replacement a little bit sooner.
Yeah, more weight, more pressure on the joints.
Yeah, which is just fact. And sometimes we can't control that, right? But what they did see is that for every 1% of weight loss was associated with a 3% reduction of the risk of hip replacement. We're not proponents of like saying you need to go on some diet or you need to lose weight, but how can we start to maybe move and eat in a way that helps to support our body so that we naturally maybe start putting off some weight?
And maybe naturally reduce the inflammation that the foods we eat cause in our body. Again, the weight, regardless of what type of weight, like when I look at my BMI, I usually land in the overweight category. Because I have a higher amount of muscle mass and that puts more pressure through my joints. I'm already somebody who has had injuries in both of my joints knees and surgery on one of them. So if I get later in life and I'm having knee pain and see radiographs saying like, hey, we're seeing degeneration, like weight loss is definitely going to be a thought in my mind to say, hey, how can I take 1% of weight off, or 10 pounds off to maybe lessen the load? Because every pound we lose, that also magnifies through our joints, depending on if we're walking upstairs or if we're going for a walk or a run or walking up or down a hill. So very important. That's also why water-based exercises can be really important, especially if you're somebody who feels like you want to drop some weight, but moving in general is really tough because of the pain.
Yeah.
The water-based exercises can be very important.
Yeah.
And when I mentioned that there are surgeons who will give plans to people, I remember a lot of people who are coming in for prehab who were overweight, and their surgeon had said, oh, I need to lose 30 pounds before they'll consider doing my surgery. And again, it's not meant to be a discriminatory thing. It's meant to be a thing that's going to set you up for the best prognosis post-surgery.
Right. Yeah. So it's very common. And I think it's just another example of continue to keep moving and continue to focus on the things that are just going to help our body rather than worrying about the weight loss and all that other stuff.
Yeah.
Right? Because that could add another stressor to it. And we do just continue to see how powerful exercise is, especially when we compare it to like taking NSAIDs or, other anti-inflammatory drugs. If they are pretty comparable in the research, well, then something that's just keep moving. And do that in the best of your ability.
I think the first thing is finding something that you enjoy.
Yes.
And understanding what you enjoy to do. I mean, my ultimate recommendation would be like, what is this hip pain or hip osteoarthritis keeping you from doing that would bring you joy in life? Is it being able to walk and go to a picnic with your family, walk and see your grandkids play a sporting event? Is it just getting up and down from chairs that's really difficult, or getting up and down from the toilet that can become increasingly difficult as we have joint pain? Like, how can we slot that into the exercise or training that we're doing? A lot of these things do require strength gains, or do require us to have strong muscles that support those joints. So strength training can be a very important component of it, but it doesn't need to look like lifting weights. It can look like just sitting and standing from a high chair and then progressing to slightly lower surfaces. That's a great way to start to really build strength in those joints.
And again, we talked about following something directed, following something especially in person that you're doing with someone. We do have a hip plan on Gen Health. If you are severely limited in range of motion, it's probably not going to be the plan for you. I'm going to say that up front, but there are going to be some things where you just are checking in for 8 to 15 minutes and starting to move your body, starting to improve your connection to your inner core, to your glutes, to these muscles that you maybe feel that you don't have as good a connection with, and strength through movement. A lot of these exercises that we're not just doing mobility, we're doing stability, we're doing that reconnection, that neuromuscular retraining as well throughout Gen Health. And, something that I saw super powerful, I remember I saw a patient who she was going to go and get a hip replacement, but she was taking it upon herself to go and get some exercise recommendations prior to the replacement because she knew she was having such severe pain just getting out of a car, standing up straight when walking. Like all of these little things that she had to keep doing before she even got the replacement were so difficult. And some of the things that really helped was just starting to reprogram how she's getting that intra-abdominal pressure from her rib cage to her pelvis and reconnect back into her hamstrings and glutes and connect to that pelvic floor in a different way. And all of a sudden, she was walking upright. She didn't have that pain. She was getting out of her car without pain. Again, not to say that she didn't have pain anymore and she didn't need the replacement. She still knew that she was going to get the replacement, but just to be able to go through her daily activities a little bit lighter without having that heaviness of that pain.
We also have a core plan that is a great progressive way to reattach and reconnect back into that core. For people who are looking for strength, that might be wanting some sort of strength exercises. There's a plan, the full body low impact plan.
I love that. That's my favorite plan.
Best plan, and it's great for people who have knee, hip, different joint pain that are looking to be able to strengthen without having as much pain. So all those plans can be great places to check in. We have a special discount for our podcast audience if you want to go check out and start your free trial. You get a free week first, and then if you use code OPTIMAL, you'll get a discount on the first month so that you can check out some of these plans. See if it's something that helps you connect back into some of these areas in your body.
And doing a plan for $20, following it for 30 days and really committing and seeing, do I start to feel change? Do I start to notice something different? Thanks so much for joining us on another episode. I hope you really enjoyed it and start to understand some more things about what you can do to really help your body and where this whole pain really comes from. Looking at the whole picture, looking at yourself as a whole person, not just structural issues, right? So if you have more questions, please drop them below. If you have more specifics of areas that you want us to cover on the body, whether it's pains or diagnoses, please leave it in the comments. We need to hear from you so we understand what podcast to continue to create for you and what research you want us to dive into.